goes deep. So those are always going to be the first 3 instruments. Then it's our plastic filling instrument or composite instrument, scaler for carving after. And I just have the plug or condenser out just in case. On posterior, sometimes we may need that to kind of help plug or condense that composite down. So I'm not going to make you guys pretend to give injections again. I think everybody's pretty good with that. So we can start right with prepping. So I do want you guys to continue practicing with prepping. So if we're doing 30 DO, and you're probably okay there. Oh, I should have also finished with the trace setup. So we are going to use a sectional matrix. So there's our ring, our sectional matrix band, the forceps, our wedge, cotton pliers. We're also going to use a primer, or an etchant, and then we have a primer and an adhesive. So in the video they did a 1-step process. We're going to do a 2-step process. So we're going to have a micro brush, one for the primer, one for the adhesive, and then this is our posterior composite material. We would also take a shade right when the patient sits down. These are natural tooth shades, so they don't match our plastic teeth. So none of our composites would match this guy. And then the shade of the composite's actually on the side. So what you would do is you would match up, take the shade, and then you would grab the right or the appropriate color composite.
So offices just have like a ton of those, like in every shade?
Yeah, so there's a, yeah.
Okay.
And on posterior, it's not such a big deal. It depends on the office. Some always use a certain shade on posterior, maybe an A2, A3. A1 is light, B1 is light, so yeah. So then we would prep. We're gonna pass our instruments again. Are you good? Do you need the spoon?
No, that's fine.
Perfect. So then we're going to place our sectional matrix band. So it's just this little peanut. If we go in the distal, and usually it would be the operator placing it, but again, it is one of your delegatable duties, so you guys can. So I'll have you guys practice passing it to each other and having the operator place it, but I want to make sure everybody actually places it. So if you guys do want to come in and kind of come around, that peanut's going to go on the side.
Okay.
And then we would place the wedge.
Oh, there is a wedge, because I don't think they used one in the video, did they?
They used to.
Yeah.
They did? Yeah. Okay.
So the wedge would be the same. So you would pass. Yeah, anytime we use a matrix band,
On this side?
it would go right behind. There you go. Good. And then you guys would pass the forceps with the ring. Some of our rings are a little stretched out, so hopefully they stay on, but this ring is gonna sit right on top of that wedge. On this one, because we're doing a DO, we're gonna have it go towards the distal, so when I load it, I'm gonna come in and load it like this. You drop that bar down and it's gonna hold it open. So I would pass it, actually pass it so she can place it. So now she's gonna come in.
Like, I don't know how it works.
So she's gonna come in and would place it right on top of that wedge.
Oh, really?
So it just sits, so the point of the ring is, it's a tension ring, so it's gonna push the contacts of the tooth apart so we can overfill the prep or get those nice contact points. So this one, it's a little loose on there, so I wouldn't use this one. If I were actually using this on a patient, I would get a different one because this one's stretched out. I should actually grabbed a different one anyway. All right, so then just be careful that you don't bump them because otherwise you'll shoot them off. Then the next thing we're going to do is we're going to place our etchant. So always expel a little etchant on the tray first, just to make sure that it's not clogged. We did have one girl in the hygiene clinic who was placing it on a patient and didn't check it first, and the cap actually shot off and got etchant all over the patient. So this is a 37% phosphoric acid etch, so it will do a chemical burn on anything that it touches, tissue or anything. So, so now we're just gonna place that etchant all over. We're gonna do the total etch. So all over that surface. It stays on 15 to 30 seconds, no longer than a minute. So it's usually up to you guys as the assistant to kind of pay attention to the time. So around 15 seconds. In the meantime though, I should have grabbed
What do you need?
gauze 2x2s. In the meantime, I'm gonna get my primer. I'm gonna put my primer in the dampened dish for A. And I'm gonna put my adhesive in B. Thank you, by the way. And I'm gonna cover that because it is sensitive to light. So now I'm gonna come back and suction. So when you suction the etchant, you wanna be right on top of it with that HDE. I knew that was gonna pop off because it's too loose. So you wanna thoroughly rinse that etchant off, and then you're gonna dry. So drying after etching, it should be chalky white. So that's how you know it's been properly etched, is when you dry it and it goes in and you can see it's chalky white. So then what we're gonna do is I'm gonna pass one of my micro brushes, I'm gonna dip it in A, and she's just going to apply it. So that's my primer, and she's gonna kind of rub it around. We wanna do that for about 20 seconds. In the meantime, you don't have to rub the whole time. In the meantime, I'm going to flip it, and I'm going to get my next micro brush, and then she would usually come in with her air. I'm going to have you grab your air water syringe. And then always just kind of blow a little air off to the side to make sure, there you go. Going to come in and kind of blow a little air over it. Perfect. Now we're going to grab the adhesive, and she's going to place the adhesive on. And you always put your thumb over the other one so they can't dip in the wrong one. Good. I'm gonna set that off to the side, and then I would come in and light cure the adhesive. So you don't light cure the primer, but you light cure the adhesive. You can really light cure that. It's not gonna do anything. 20 seconds. Unless the dentist is impatient, and then they're like, okay, that's enough, and they'll shoo you out. All right, so then with our composite, so we're just gonna come in, and we're just gonna, there's a couple different types of composite. I'll have you guys practice with this one for posteriors, and then tomorrow when we start on anteriors, we'll use the flowable or the more flowable type. So you do wanna cover it up because it is light sensitive. So then what we're gonna do is you kind of roll them into little balls. And a lot of times you can just pass it to the dentist in a little ball. Again, it is light sensitive. So at this point, they would actually have you turn the light down, or some of them have the little yellow shield so you can flip the light, so it's a yellow shield. You're gonna cover them. As soon as they pack that set, you're gonna come in and light cure. And I don't want you guys, please don't light cure. Otherwise it takes me forever to try and get them out. Then they would grab a little more. You're also going to have another gauze 2x2 in your hand in case they need to wipe their instrument. It would come in and light cure again. Actually, it looks like you're pretty full.
Yeah.
So, all right. So once we're full, we finish light curing. Then our band would be on. So we would pass our forceps again. So she's gonna come in, take that band off, so keep it close. There you go. Perfect, you're gonna grab that. And then pass that cotton pliers. And actually the wedge. Oh, that works too. That's okay. And then we'll come in. Usually it's the wedge and then the matrix band, but that's okay. That came out pretty easy. And then they would go in with their burrs and adjust. And while they're adjusting, so you don't really have to be in with the suction, but sometimes, because they're usually going to shut the water off at this point when they go in and smooth it and adjust it, but it's just kind of the flakes. So you guys have all filed your fingernails, right? And you know that kind of powder, it's very similar. So you don't have to be right on top of the tooth. You just have to be kind of in there because all the little flakes or powder will go into your suction. So. Good. All right. Then like normal, we check the occlusion. Good. And floss. And with this is set up right away so your patients can eat and drink right away. So you can, this one's fully set, so you can pop it down and pop it back up.
Oh, okay.
Yeah. So this one they can eat and drink right away. It's completely set. Just be careful until the anesthetic wears off. So, yeah, pretty easy.
Should I get